Well, we're joined today with Dr. Joshua Grubbs. He's an assistant professor at Bowling Green State University, clinical psychologist like myself, with research interests in the psychology of religion and spirituality, as well as psychology of human sexuality and addiction. So those are really helpful with this topic of why do people struggle with porn? And I've really benefited from the research that you've produced over the years that has really been in line with a lot of the things that I've discovered in working with people with sexual concerns like pornography viewing. So why don't you tell us a bit about your journey and how you got to where you are today, and then we'll chat about some of the things you found.
Yeah, certainly. So I appreciate you having me and taking the time to talk. I've been researching, it sounds absurd to say this now, but I've been researching pornography use and self-reported problems with pornography or people feeling like they're addicted to pornography I've been researching it, I guess, for 12 years now. Our first article I ever published on it was back in 2010, but the research started before then. And, really most of these ideas they've developed and changed over the years, but it all started really when I was an undergraduate student. I went to a very religious Bible college. I went to Liberty University for my undergrad. I was born and raised in just a very conservative evangelical Christian culture, and that's where I went for my undergraduate training. And this was right back, so I was there from 2006 to 2010, and that was right when the kind of porn tube website explosion sort of happened. As long as the internet's been around, there's in pornography of any type, but it was that time that things really started to uptick with the kind of YouTube style of pornography with videos that were easily accessible. And I just recall back when I was a student there, how concerned the spiritual leadership was on campus, how concerned local pastors and youth leaders and we had a lot of campus pastors as well were with this notion of pornography addiction. And I remember one time in particular, there was a religious service. It was during some special kind of spiritual emphasis week is what it was called. It's called Spiritual Emphasis Week at Liberty. And I recall this one pastor saying something to the effect of, 50% of young Christian men are addicted to porn.
Wow, that's a huge number.
50% is a massive number. And I remember, I was 18 or 19 at the time. I can't place it that accurate. It was 18 or 19, one or the other. And I remember thinking, wow, that seems like a really big number. Even though I certainly thought a lot of people is a huge number. I mean, if 50% of any group of people is dealing with an addiction, that's a crisis. That's massive. If 50% of young men were dealing with heroin addiction, what would young men look like? So yeah. I recall thinking this number seems really high, but my reaction was not like, oh, it's so high, it must be so bad, which is what a lot of people were thinking. My thought was, I'm curious if this is actually an addiction.
Wow.
If 50% of people are saying they're addicted, that seems almost impossibly high.
Yeah.
And that's where it starts. So as an undergrad, kind of that idea, that sophomore, junior year of college, that was really kind of percolating in my head. And then, it just has evolved. I researched it a lot in grad school, and I was fortunate enough to get a nice faculty job after grad school where we've continued researching it. But that's kind of where it all started.
Yeah. So you're coming from that religious context where this is a big concern that people are talking about, and often it is coming from that place of, I want to help if this is a problem. Mm-hmm. How do I best reach people? Mm-hmm. And sometimes the approach that we're using can kind of accentuate the problem. Or if it's like, oh, it's huge, it's 50%, it's an addiction. And you've kind of looked at how some of that language might contribute to somebody's struggle with pornography.
Yeah. I mean, that's one of the big things that we've taken kind of a closer look at through, a lot of different ways over a lot of different studies over the past 10 years. And really clear about this. Research is to try to say, oh, using pornography is great and wonderful and you should feel good about it. That's never been what we're trying to say. But what I've really been interested in finding out is, how do your moral beliefs about pornography, how do your personal beliefs about pornography influence how you think. So yeah, I mean, this has been one of those questions that I've been toying with or examining and researching using different methods, different ideas, different study designs, different populations for 10 years now. And it's this idea of how does a person's individual morality and individual belief set really impact how they're interacting with pornography and how they feel about their pornography use. I want to be clear, and I'll probably say it a dozen times today, is the purpose of my research has never been to say, oh, porn is fine and you shouldn't feel bad about it. Yep. The purpose of my research is to really try to understand what makes someone think they're addicted, and does that label of addiction actually match what's happening in their life? We all do things all the time that we wish we didn't do. We all do less of things that we wish we did more of. We all do more things we wish we did less of. We're always struggling to modify our behaviors. There's this idea within, Christian faith of the spirit is willing, but the flesh is weak. And that doesn't just apply to like sexual behavior, right? That applies to literally everything in life. Like where we're always trying to discipline our bodies. We're trying to train ourselves so that we can demonstrate our faith outwardly. And so you can probably hear from some of that language. I'm still very much a religious person myself.
Oh
yeah. This idea of I keep slipping up, or I keep doing something that I shouldn't be doing. For some reason, when it comes to porn, the word addiction just gets thrown in really fast. If I say I wish I didn't eat so many sweets, you don't typically say I'm addicted to sweets, or I wish I exercised more. I don't say I'm addicted to not exercising. Like those aren't things that we say. But porn comes up and it's like, oh yeah, I viewed porn more than I wish that I did, or I viewed porn twice last month and I feel really bad and I think I might view it again. I must be addicted. It just, something doesn't track there, right? An addiction is fundamentally a disruptive, life-altering, damaging process. I am a clinical psychologist. My specialty as a clinician is addiction treatment. And I've worked with behavioral addictions. I've worked with a lot with substance addiction, and it's not I do this every now and then and I feel bad about it. That's not an addiction. An addiction is a completely life-altering process. And like I've kind of alluded to a few times, is I think perhaps that addiction framing isn't necessarily accurate for what we see a lot of times with people that think they're addicted to pornography or say that they're addicted to pornography. It's not that they should feel fine about their use of pornography. It's just that maybe using that term addiction isn't actually, one, it's not actually accurate, and two, I kind of question whether or not it's actually helpful in moving forward.
And one thing that you've highlighted in your research is there's a big difference between the behaviors consistent with addiction and then the perception of being addicted. And I think that's something that's rang true for me. But before you use that terminology, I don't think it was as crystal clear as that. It's like, whoa, there's a difference between this all-consuming addiction versus the perception of
yes. Yeah. And that's something that we found. Like in general, this notion of whether or not you think you have an addiction, whether you do have an addiction, like that difference between perception and behavior, it's common in the addiction treatment world, but we actually typically see the opposite. And what I mean by that is when I'm working in a clinical treatment setting for someone with alcohol use disorder or an alcohol addiction, oftentimes the behavior is so clearly an addiction, but the awareness of the behavior, the perception is, no, I'm fine. I'm not addicted.
Yeah, right.
I can stop anytime I want.
I don't got a problem.
And it's the exact opposite, where you have this out of control behavior, but the perception is that I'm fine. Well, what we're actually seeing oftentimes with pornography, sometimes with other sexual behaviors as well, but especially with pornography use, is that it's the exact opposite, right? That it's the behavior is not out of control. We're not talking about somebody that's typically, there are examples of this, but oftentimes the person that wants help for pornography addiction is not somebody that's spending hours every day viewing pornography. It's somebody that's, viewing pornography once a week, maybe twice a week, 10, 15 minutes each time. But they feel just crushing guilt and shame over the behavior because their religious beliefs, their personal morals, and their values tell them they shouldn't do this behavior. Now, as a therapist, my goal, if you tell me my values are that I should not do this, my goal is to help you live your values. Like, I want you to do that. But I don't think that not living your values means that you have an addiction. It means you're human, right? And that you struggle to live your values. It means, it does mean literally the spirit is willing, but the flesh is weak.
Yep.
If you want to take that framing, that you want to be doing something different, but you're not. Now, calling that an addiction or perceiving that to be an addiction is probably not going to help you make the traction that you need to make to living with your values, because addiction, that's a heavy word, and it's a stigmatizing word too, that I often think it carries a lot of baggage with it that isn't helping people, especially people that aren't actually dealing with an addiction.
Oh yeah. And as a fellow Christian, that speaks to me what you talked about, that these are human concerns. Like, there's a lot of really well-intended people, and yet we all engage in things that are inconsistent with our values at times. That is the state of this human condition, and not necessarily a pathological process that's going on.
Right. And I think that that's something that, and probably, I was going to say for better or for worse, but probably for worse, that often just kind of gets mixed up, especially in the messaging I see from religious groups around pornography. It's not cast as just being a human struggle or just a moral struggle. There is often this heavy emphasis on it being an addiction, or it changing your brain, or it doing this or that or the other, when the reality is for the majority of people that are at that support group in your local church or in this or in the online community for it, aren't people that are necessarily dealing with a genuinely disruptive behavior pattern. They're dealing with falling short of their morals and their values, and they need support getting there. And so a 12-step program can be a wonderful tool for a lot of people dealing with a lot of things, but you probably don't need a 12-step program if you're viewing porn once a week. Like, that's just probably not the best approach to moving forward.
Yeah, for sure. I've appreciated that mindset where, these approaches aren't necessarily bad, but they may not be the best fit for kind of where you're at. And I think the one thing I've noticed is the addiction language, it just permeates this struggle around pornography and compulsive sexual behaviors. Or even for me, I didn't think about this in another way until graduate school. That was the only language that I had where, yeah, if you're struggling with porn, it's an addiction. Everybody knows that. But then to slow down and be like, well, maybe there's some other patterns to think about. And so you're highlighting that maybe this language is a little bit more common among religious community. And I honestly never thought about it until you highlighted this, that when I am working with people with substance use problems, they don't see it as much of a problem, even though it's very much disruptive in their life.
Yep.
And that opposite is true with pornography. I'd never connected that, where it's like, this is a huge problem, and yet it isn't as disruptive. I've never really seen those, and that they're like exact opposites.
Yeah, it's a fascinating contrast that, in my clinical work, I do a lot of this therapeutic style called motivational interviewing, right? Which is entirely built on the idea that I'm going to kind of help you see that maybe you want to change your behavior because you aren't there yet, and you need to be there. Whereas, again, with this pornography idea, we see the exact opposite, where I often am trying to help clients, or even in our kind of public work around this, I'm not trying to get you to say, hey, porn's great, I like porn. What I'm just trying to get people to say, hey, instead of framing this around addiction, let's frame this in terms of what your values are and what you want to live, the life that you want to live, and what that looks like. And instead of saying, oh my goodness, I lost my sobriety, or I fell off the wagon and I viewed porn, you say, I slipped up. I did something I wish I hadn't done. And that sucks. I feel bad about it, but I'm going to accept that I did that. I'm going to accept that I felt bad about it. And then I'm just going to move on, and just accept that it happened, accept that there was a little bit of negative emotion about the fact that it happened, and then move on, instead of getting caught up in the cycle of I'm an addict and I keep slipping up, an addict, I keep falling back in, I'm an addict and the word relapse comes up a lot. I've seen in some of these communities where people are trying to quit porn, and I think that framing might not be helpful, because it places so much heaviness around what was likely a quick momentary thing that you may be better served just moving on from.
Yeah.
It's not, giving yourself license to do it whenever you want. It's just saying, hey, okay, I messed up. Time to move forward.
And that's been the biggest challenge I think I've found in trying to shift this conversation, or it's if you don't use addiction language, often there's this kind of response where you must not think this is a problem then. Or
Right.
you must be okay with porn. And for me, it's always like, no, clearly people are struggling with this behavior and they want to change it. And it is inconsistent with somebody's values. But it's just that language around addiction that may not actually be helpful in people achieving that goal.
Right. I mean, certainly. And it's one of the things that like I try to communicate clearly with people is like, if you're using pornography and you think that your use is a problem, that by itself is proof that there's a problem there. It doesn't necessarily mean that you have an addiction. It just means that something needs to shift. And we've shown this in studies. Like we've shown that thinking you're addicted to pornography predicts things like depression and anxiety over time. It predicts things like relationship struggles. It predicts things like general, just greater levels of stress in your life. It predicts things like feeling like your faith life is not where it's supposed to be. And all these things happen over time. And it's not the porn use itself. Like it doesn't matter. It doesn't seem like from our studies, whether you're using porn, once a month or once a day, that's not predicting whether or not you're having those problems. It's whether or not you think you have a problem. Now, some people interpret this as me saying, well, you just need to just stop thinking you have a problem. And that's not at all what we're saying. What we're saying is, well, if you think you have a problem, then clearly something needs to shift. But we need to really think about what needs to shift here. And it's probably not, oh, I need to go jump in a 12-step group. It's probably, I need to find ways to live the way that I want to, while also not ruminating on the times that I didn't.
Wow, that is so powerful. I want to rewind that for a second just so people pick that up. What predicted mental health problems or concerns with spirituality or concerns in relationships was the belief or the thought that you're addicted to porn.
Yep. It was
That's
the belief
what predicted that.
Yeah, it wasn't the actual porn use itself. And we've shown this. I mean, we've shown this in longitudinal samples of college students. We've shown it in longitudinal samples of adults in the U.S. We've measured this over a month, over a year. We've shown it, in samples in Poland. We've got a study going right now where we're finding the same thing actually in a majority Muslim population sample out of Malaysia.
Wow.
Like it's a consistent idea, and I've got collaborations going on in Israel with the Orthodox Jewish community. It's this consistent thing where this feeling of addiction is driving these other concerns that are associated with it, more so than the frequency of pornography use. And most often that feeling of addiction seems to be itself being driven by feeling like you're falling short of your morals.
Yeah.
It's not, we've shown this in a few studies in the US where if I ask you, how much do you view pornography? And then I ask you, do you think pornography is morally wrong? The better predictor of whether or not you're going to tell me you're addicted to pornography is not how much you're using. It's how morally wrong you think it is.
Wow.
And it just shows, I think this is fascinating. And again, I think it shows a real problem. It's just not necessarily addiction, but it shows just how powerful our own perceptions of our behaviors are. So much of what we do in life is it's not just the behavior itself. It's not just the events that happen to us. It's not just the relationships we have. It's how we think about those things that shifts things. And so learning to accept, what has happened instead of getting so attached to what you wish had happened or what you wish had been different. It's just a powerful shift when you can just accept that sometimes you fall short of your morals. Sometimes you don't live up to your goals, and that's okay, because you can try again tomorrow. You can keep working ahead.
I love that. And what I appreciate about that, it's not dismissive of this is not a concern. It's actually, this provides a lot of hope. Like we can do something about this. That perception is keeping us stuck. We can work with that. It doesn't mean like this isn't an issue or good luck with that. It's, now we can hone in on what the problem is. And that's been so consistent when I'm working with people over the years is I've worked with people that are viewing porn several hours every day, others that it's every couple of months, but the level of distress is like the same.
Yeah.
It's like,
and it's a
independent
different
of what they're viewing.
Right. And those are different problems, right? Like you have the guy, I can recall clients that I've had that had literally been fired from jobs because they kept viewing pornography on their phones at work. And I'm like, okay, so how we treat this is going to look a lot more like how I treat an addiction. Like we've got to
Yep.
have a behavior plan, all these contingencies, these steps, these things to remove access. There's all of these steps. That is so different than the person who's telling me that they feel addicted, even though they're only viewing for 20 minutes twice a month.
Yeah.
They both need help. They both need to work with someone if you have access to a good counselor who can talk you through this. It's just, you don't need me to set up a 12-step plan for removing all of the electronic devices in your life and blah, 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 so that you're not looking at porn if you're viewing twice a month. We just need to think about how do we reduce that frequency even more if that's what you want, and how do we not get stuck thinking about the times we fell short when we do fall short.
I love that. So taking a more nuanced approach, instead of like, oh, you viewed porn, you're all in the same group now.
Right.
So they're really different reasons, different functions, and the treatments are going to look quite a bit different. Yeah.
Yes, certainly.
So one thing I came across maybe a couple months ago, and I don't know if this study's out in press yet, but you did like a 20-year review of kind of the state of the addiction literature. And then the part that's also haunting is like, now let's look at the treatment outcome studies. And it's a little teeny section.
Yeah.
I'm curious if you could overview, what have we learned about the kind of the properties of sexual images and the addiction literature over the last 20 years?
Yeah, so we the paper actually did come out. So it's the title of the paper is Sexual Addiction 25 Years On. So we actually
25,
reviewed
even more.
It was 20 years when we started, but the reviewer asked us to switch it to 25. So we looked at everything from 1995 to 2020 that had been published on in the sexual addiction research literature. It came out in Clinical Psychology Review at the beginning of last month. And we reviewed about 370 papers. And there's just a ton of research coming out on this topic now. It didn't used to be this way. There's been an increased interest. There's been from a lot of different sources. And what we know is like we've got a lot of good research now that kind of points to the idea that some people definitely develop what we could consider what most people would call sexual addiction. Now, researchers will debate whether it's an impulse control disorder or a compulsivity disorder, or is it an addiction? That's kind of meaningless in the real world. What it really means is there's certainly evidence, we have a lot of evidence now that some people just develop completely out of control sexual behaviors. And there's also a lot of evidence that one of the more common expressions of this is pornography use. There are people that are spending hours and hours every day. And when I say pornography use, just to be clear, this also implies masturbation, right? Because pornography use is the frequency of pornography use and frequency of masturbating to pornography. It's like a one-to-one relationship. That's what people use pornography for. So these aren't separate things. They're often the same thing. And so a lot of people have seemed to have developed this problem. Now, it's not 20, 30, 40, 50% of men that are dealing with it. Our best estimates are suggesting that probably somewhere between 2 and 4% of men some estimates are slightly higher, but in general, we're probably talking about 5% or less of men and even lower numbers of women that develop this. So we have this evidence that this exists. But you're right, when you look at, well, how do we treat it? And there's like 11 studies in 25 years. I mean, there's more than 11 studies on how to treat like fear of heights in the past 10 years than there are. So like this 11 studies may sound like a lot to some people. That's not very much in 25 years. Yep. And of those 11 studies, almost all of them are exclusively in men, which, okay, that's fair. Men are more likely to have compulsive sexual behaviors, but it says something about our ability to even help a woman who's dealing with excessive sexual behavior. And only 2 of them use what we call randomized controlled design or a double-blind design, which is in clinical research is kind of our way of knowing, this is the standard for knowing, did a treatment work? So there's been 2 of those studies that can actually show whether or not a treatment works. Now, those 2 studies, I'm actually a big fan of both of them. One showed some pretty decent evidence. It was a small study, but pretty decent evidence that something called acceptance and commitment therapy is quite useful. And then there was another one that came out of Sweden last year, and this one was a much larger study, like I think it was 170 participants, which is quite a bit for a clinical treatment study. And they showed that it was a group-based cognitive behavior therapy protocol, which is a cognitive behavior therapy is also just a very common therapy, could treat problematic pornography use and compulsive sexual behaviors. So those are very promising, but again, we have basically 2 studies and 2 types of therapy that have been identified as possibly being useful. There's just so much work that needs to be done here now, because we don't know, does it work for women? Does it work for young men? Does it work for sexual minority men? Does it work for men that aren't in Sweden? Like I said, one of these studies was in Sweden. Does it work for people not in Sweden? So there's just all sorts of questions that we still need to answer.
And I appreciate that review, because as myself, I use a lot of ACT in my clinical work. And part of the reason why is this is one of the few treatment approaches that has evidence that it's going to be helpful for compulsive pornography viewing. And I wish there were dozens and dozens of studies showing that, but there isn't. I found 3 ACT studies that look at addressing porn issues, and they're all promising, but there's only 3.
Yes.
And I think about, of those 25 years that you looked at and hundreds of studies, only a couple were actually looking at treatments.
Yeah. I
think as researchers and clinicians, we've been bogged down on this debate of, is it an addiction or not? And it's like, well, clearly people are struggling. Let's understand the reasons. And now let's look at ways to help people.
Yeah.
And that's the part that's been lagging.
Right. And I certainly agree with that. And I think, 2 things come to mind with that. One, it was last year that the World Health Organization voted to include compulsive sexual behavior disorder, which is basically what we would call sex addiction, as a fully recognized diagnosis in the International Classification of Diseases. And that's a lot of technical words. But what it really means is that there's now an actual diagnosis that therapists can use. That's going to spur more research into treatments. I know of a couple of treatment trials that are underway right now. They haven't been published yet, that look at different ways of treating compulsive sexual behavior and problematic pornography use that only came to be because that diagnosis was recognized. I think the second thing that this all brings to mind to me is, like you said, there are 3 studies that look at ACT. And I believe all 3 of them are actually from the same research group. Yep. But what I think is really cool about that is, from where I sit, having done all this work on how moral disapproval, this feeling of moral incongruence, that feeling of just feeling morally wrong viewing pornography, whether you come into therapy saying, I'm viewing pornography 3 hours a day and I need to stop, or I viewed pornography 3 times last month and I feel really bad about it, acceptance and commitment therapy offers a framework. Now, the treatment's going to look different for you guys, but the framework is going to be the same. And what I mean by that is, we're going to talk about learning to accept what is. We're going to learn to let go of our attachment to what we want it to be. And then we're going to talk about ways to live consistent with your values. Yep. Now, the interventions beyond that are going to start to get much different. Like I said, we're going to have a much more rigid behavioral plan if it's really 3 hours a day. But we're still going to use that same basic principles. And so that may not mean a lot to the person that's in therapy, knowing that, my therapists can use the same framework no matter what. But to therapists, learning, hey, if I learn how to do ACT, if I can really get involved in this, there's evidence to support that this will work for the whole range of pornography-related problems. I think that's helpful, and it makes it easier to get help and treatment to the people that need it. And then the other thing is, one of those 3 ACT studies actually made use of a self-help book on ACT, which means that you can just distribute that to people. And I think that this is an aside, but I just think that the acceptance commitment therapy people have done a better job translating their ideas to self-help books that actually work for people than any other therapy modality I've ever seen.
Oh, for sure. And I think that's what maybe got me most excited about your research, is it fits so well with the ACT framework, where it's like, if this is moral incongruence and our attachment to language, we can work with that. And ACT is designed to look at, let's look at the function of language, and let's look at these behaviors and understand what's really going on. And ACT is one of those approaches that actually intentionally carves out space to talk about spirituality and religion. It's not just, we want to reduce symptoms. It's we actually care about you developing a good life. And for a lot of people, that consists of relationships and belief systems and religion. And I appreciate that flexibility and that framework. And coming across that study where even just reading a generic self-help book from ACT was helpful for people reducing their porn viewing. And that's kind of what led to me developing this online self-directed ACT approach for porn, where it's like, wow, these principles work. We just need to make them more accessible to people. And they don't need to be stuck for years and years of being an addict. It's that with the right concepts and approach, people can move forward in their life within weeks to months instead of years and years.
Yep. That's certainly, I mean, certainly the case. And then the more that can be done to translate this into very public friendly, kind of easily accessible ideas. And I mean, it's one of the things that I love about ACT. It's actually one of the things I love about motivational interviewing as well.
Oh, yeah.
There's just this idea of like, we need to get this out to the people that need it. It's not about branding. It's not about copyrights and who controls what. It's about how do we help the most people. And ACT does it does a good job of that. And it's been, I mean, my own clinical practice has been useful for almost, I wouldn't say every single case, but the full range of pornography related problems. I mean, some people come to therapy and they still struggle after therapy, but the successes I have seen around pornography use have almost always used an ACT kind of framework.
Oh, that's awesome. Well, Josh, you know so much about this area and you work with addictions in general. I'd love to hear what you found in your counseling work, but in your research work, about what might be similar with like substance use, like alcohol or drugs, and viewing sexual images. As far as biologically, neurologically, what are similarities and what are distinct differences?
So, you know, there's a growing body of research around this, and I should preface this that I'm not a neuropsychologist, so this isn't, you know, necessarily my greatest specialty in this area. But, you know, we do know, right, that there's a lot of talk in the public. There's often a lot of, you know, popular articles about this idea that porn changes the brain and it's just like a person that's addicted to. And I've seen people say that the brains of people on porn, these are popular articles I've read, that porn does the same thing to your brain that marijuana does, the same thing that cocaine does, the same thing that heroin does, the same thing that alcohol does, and the same thing that ecstasy's done. I've seen 5 of those. Now, again, I'm not a neuropsychologist, but I can tell you there's no way that one thing can affect you all of those different ways, because all of those drugs affect you differently. So it's not necessarily the most coherent argument when I see it. But there is concern, right, that people might have neurological changes after viewing pornography. Well, I mean, what we know is anything that is highly pleasurable and rewarding is associated with brain changes, with learning, with reward salience. There's all of these fancy terms, but essentially there are processes in the brain that happen when we do rewarding things. It seems like for some people, that reward process associated with pornography use maybe does go a little haywire. But there isn't necessarily evidence that that happens to everyone or that pornography always does this. You know, there are people that if you and so this is, I think, a key difference between this and most substance use, right? If I give a person heroin, I will go to jail. But after that, if I do it consistently, their brain is going to change. And every person that uses heroin is going to show a very similar set of changes. Very similar neurochemical pathways will be altered, very similar structural changes. The same is true for people that use alcohol over years. The same is true for people that use cocaine over years. There's no evidence that everyone that just uses pornography, that this is happening. And I think that that's key when we're trying to understand whether or not pornography should be thought of like a drug. Well, it's not directly influencing the brain the same way that drugs do. It doesn't mean that some people don't experience brain-related changes, or for some people that they don't get, you know, obsessive or behaviorally kind of conditioned to do this constantly or develop an addiction, but it does mean that it's not the same process that a chemical addiction maybe is using. And I think that that distinction is key for a few reasons. I mean, one, it approaches how do we view this in the public in general. Like, we regulate drugs that alter your brain directly. There's not yet evidence that we should regulate pornography because it's just altering your brain. So, like, I mean, there's policy level differences that happen there, but it also, I think, affects how we think about it from a treatment perspective. You know, to date, there's no evidence of the notion that you would need to detox from porn, that you could withdraw from porn. Those just aren't things that actually they don't make neurological or neurobiological sense because it's not a chemical that you're removing from the system. And My concern when I see people toss around these biological terms is there's this idea that people are viewing porn and they're wrecking their brains and they're doing damage and that they'll take years to undo it. And we just don't have evidence to say that that happens. And I don't like, I mean, I've seen it in clients and I've seen it in study participants, and I've certainly seen it on the internet, like people genuinely being distraught over what they've done to their brains and their bodies by viewing pornography, when the evidence so far is that even if you've developed a problem with pornography viewing, even if you're viewing a lot, you probably haven't done anything to your body that can't be reversed with a few days of good rest and regular meals and some exercise. And so that concerns me, because have seen people genuinely anxious about the damage they've done, thinking in very much the same terms that I've seen people talk about, well, I've been drinking for 20 years. What have I done to my body? Those are just different things. And you don't need to have that concern when you're also trying to change your behavior and trying to move forward from pornography.
Yeah. I appreciate that view, because it's not dismissive. It's actually hopeful to say that, yeah, you are concerned about this, but a lot of this is coming from that moral incongruence, less of that physical part, but that's still there because things like food and sex and drugs are reinforcers.
Yeah.
They feel good. So of course it's going to interact with us neurologically, but we don't see the same thing. Like after methamphetamine use, that may take a year or so to recover neurologically from something like that. But viewing sexual images, we just don't have that same kind of comparison.
It's just not going to have the same type of effects. And it's not to say that, I mean, if you're viewing pornography multiple hours a day and you just quit, you're going to deal with probably some weird emotions and sensations after that. I'm not necessarily sure that those are neurologically based, in so much as it is just learning how to, fill your time with something different and dealing with the stress of resisting cravings, right? I mean, again, for people that have dealt with genuinely dysregulated, compulsive, or addictive pornography use, there is a lot of craving management when they're done of learning to say, like, I want to view porn, and I had the desire to view porn, and now I'm trying to manage the desire. And now I feel anxious because I'm managing the desire. And that anxiety and stress feeling over trying to manage your desire is not the same as withdrawal from, with alcohol, which you can literally die from, or withdrawal from benzos, or like, anxiety drugs, which you can literally die from.
Yep.
It's just a different kind of process.
Yeah, they do feel really different, because often I've seen that people that keep viewing pornography, they're doing it to cope with emotions. Like stress and loneliness and sadness. So if you stop using the coping mechanism, the emotions show up and it's uncomfortable. And that is different than physical withdrawal symptoms.
Yes.
Yep. You also brought one other point up that I haven't really talked about much with many researchers. And it's this, I don't know if I guess we'll call it a confound, but in a lot of this research on the impacts of pornography, there's not a lot of control for, well, people are viewing porn and masturbating.
Right.
Like that is a physical behavior. And I'm curious, with all this literature, we've looked at the impacts of porn. How well have we actually controlled for that behavior of masturbation?
It's very few studies that have looked at this. And on the one hand, that's a problem, and I'll explain why. On the other hand, I think it's less of a problem, and I'll explain why.
Oh, good.
So it goes both ways a little bit. So yes, that's a problem, because we were just frankly not looking at the actual sexual behavior. I mean, at the end of the day, viewing pornography, we call it a sexual behavior. It's only sexual because you're masturbating. If you're just viewing pornography for the aesthetic purpose, which is extraordinarily rare, and people that tell me that they view pornography just for, the appreciation of the art or something like that, I'm always a little skeptical.
Yeah.
But in theory, that can happen. Well, that's at that point, that's not a sexual behavior. That's viewing something, because you're viewing something. That's the same as any other entertainment venue or appreciation of art or whatever. So on the one hand, we've been ignoring the actual sexual behavior of pornography use, right? The actual sexual behavior is masturbation. That is, in men, it is, I mean, we're talking about the frequency of pornography viewing and the frequency of masturbation. It's almost 100% overlap. Men almost exclusively. Now, there are exceptions to this, and people might be listening and be like, well, I viewed porn and didn't masturbate this one time or this time. Yes, there are times that it doesn't happen, but the vast majority of the time, people view pornography as with a goal of having something to masturbate to aid in the process of masturbation, to make having an orgasm easier, some version of that. That's why pornography exists. So not directly addressing the masturbation factor is kind of a blind spot in the literature. And studies that have controlled for frequency of masturbation, and the few studies that actually looked at this versus the frequency of just viewing pornography, often find that the concerning outcomes are more associated with the masturbation than the pornography. Now, on the flip side of this, part of the reason I'm less concerned about this is because the relationship between pornography viewing and masturbation is so strong. We do, just generally speaking, if I'm asking you how often you're viewing pornography, whether or not I ask you how often you're masturbating, I've already kind of have, right? So if you tell me, well, I'm viewing pornography 4 times a week, I probably don't even need to ask you how often you're masturbating, because you're probably masturbating 4 times a week. Like that's probably what's occurring. There are exceptions to this, obviously, but in general, I think that we can speak pretty strongly about the effects of pornography use and associated masturbation on things. What we have done a very poor job of studying is what about masturbation without pornography use? There's just not much good research on that anymore.
Why do you think that's the case? Why such a focus on porn and not the associated behavior?
I mean, there's layers to it. I think part of it is the porn is kind of the craze in research, and it has been for a few years. It's new and it's scandalous, and so yes, porn has been around for a while, and there was commissions on obscenity and pornography in the 80s, led by the Reagan administration, the Nixon administration, and then the Reagan administration, and there's been fears about it since then from some Christian groups, but it's really been the past 20 years that porn's just become this crazed idea, like oh my gosh, the moral panic of porn's ruining lives, it's destroying everyone. That has happened in the past 20 years. So there's a fixation on porn at a cultural level that bleeds into research. And I think the other aspect of it is, it may seem strange, but there's a layer of difference in kind of how probing or prying it feels to ask a study participant, how often do you view pornography versus how often do you masturbate? And there's some stigma, I think, in the research community about asking kind of probing sexual questions. It's changing. We're getting better questions on it. A lot of our recent studies have been more involved. A lot of other research groups that I know have done better research on this topic as well. But just historically, I think people are a little shy about asking.
Yeah, well, that makes sense. And I think that's real. I used to think about, scientists, we're objective and we're figuring these things out. And it's like, no, we got our own discomfort and own biases, and we focus on things that are kind of key at the time. And there's lots of social and cultural factors about why we're studying things and the way we're studying things.
Certainly.
So Josh, you've done so much work in this area. If people want to read your studies to learn more, what's the best way to find all the work that you've done?
Yeah, I mean, there's a few different ways to do that. I think one of the easier ways, you can just go at my website is www.joshuagrubbsphd.com. So just www.joshuagrubbsphd.com. If you Google Joshua Grubbs PhD, that's the first result. So that's one way of doing it. We have most of it listed there where you can find them, and a lot of the studies are actually on there, freely available. I mean, another way to doing it is Google has an academic scholar search function called Google Scholar, and I have a Google Scholar page that has all of my studies listed there. So those two are probably the easiest ways. If you're into really bad dad jokes and just random rantings, and also my research, I have a Twitter at Joshua Grubbs PhD, where I do talk about my research when it comes out, but I also just make a lot of terrible jokes along the way too. So.
Oh, that sounds wonderful. And I really would encourage people to check out your research, because it's coming from such a unique angle and it's always so balanced.
Yeah.
It's like, hey, we're just looking at this. We're looking at all the factors and all the complexities, and you do it in such a very thoughtful, methodical way where it's so refreshing. Or it feels like, we're just trying to understand this phenomenon to ultimately help people live a life more consistent with their values.
Yeah, no, that is the goal. So I'm glad that people are finding it that way. I've dealt with controversies along the way. There's people that are very pro pornography that think that I'm too negative about pornography. There's people that are very anti pornography that think I'm too positive about
Yeah.
pornography, and I'm just kind of sitting here in the middle, like I'm just trying to figure out what's going on here.
Yeah.
Like, so it's good to hear that people are kind of connecting with that. It's my goal that people will see this, and it'll, I mean, my main goal is that especially like clinicians and therapists will read this and understand how to help their clients. But also, if you're one of those clients or just someone that's trying to learn more about it, that you can understand yourself a little bit better. And it's, you know, it's, again, if you think porn's wrong and you don't want to view it, then I think my research supports why that's perfectly reasonable. And let's move away from addiction and just move towards living consistent with your values. So it's my hope that it helps people. It's good to know that some people at least seem to think that.
Oh, that's wonderful. And I think the reason why I resonated with your approach is I find myself in the middle where I try not to be very extreme in my life. And I think about pornography as a tool. And for
Mm-hmm.
some people, it can be okay. And for others, it can cause problems. And let's understand how that might be for you. But I think that overreaction or underreactions, not that helpful, but understanding the complexity and
Yep.
nuance is really meaningful. And this might take some time for people to really
Yeah.
reflect on, yeah, why might I be struggling with a porn issue? There might be some things we need to explore and actually come out of this struggle even better off than where we began.
Yep. That would be the hope.
Wonderful. Well, thank you so much for taking some time to share your research and your wisdom. Appreciate it so much.
Yeah, I'm glad to do it.
Take care.
All right.